Welcome to the deep dive. Today, we're tackling something pretty fundamental. How do people actually become experts? We often marvel at what seasoned pros can do, but we're maybe less familiar with the journey itself.
Exactly.
We've got a really fascinating article today, Expert in Novice Performance, Implications for Clinical Training. And through it, we're going to explore, well, the development of expertise, specifically within counseling and educational psychology.
hmm
Our mission really is to understand the how behind expert performance in these helping fields and, what that means for maybe improving training down the line.
That's right. When we see an expert, yeah, our focus is usually on their mastery, their almost effortless ability to handle complex stuff, what they achieve.
Right.
But this deep dive is about looking under the hood, kind of, and examining the processes, the hurdles, the educational bits that shape someone into a real expert in these areas.
Yeah.
And for you listening, it's about getting a deeper feel for this development and maybe seeing parallels in your own journey towards mastery, whatever your field is.
Absolutely. And this question, how expertise develops, it isn't new, is it? Our source reminds us it's been debated for, well, centuries.
Oh, yeah.
Think way back, ancient times, learning a trade was almost entirely through doing apprenticeships where you literally worked alongside a master. Aristotle even used the example, like you become a builder by building.
Right, just doing it.
It was all about that hands-on immersion.
And what's interesting is the gradual shift that happened over time. As the article points out, with universities and professional programs growing, there was a move towards prioritizing academic knowledge, formal tests, credentials. The thinking became that a strong theory base and passing tough exams were the main signs of expertise. So we've basically had these two models kind of coexisting, the learning by doing apprenticeship way and the knowledge acquisition academic way, and both still influence how we train people today.
And you can definitely see that pension in current training, can't you? You've got the university courses, the readings, the exams, that's the knowledge part. But then there are the practicums, internships, where students are supposed to put it all into practice.
Right.
But as our source notes, there's often a real disconnect. Students who nail the classroom stuff sometimes struggle to apply that knowledge effectively when they're actually with clients.
Yeah, that raises a really key point.
Yeah.
Why this gap between theory and practice? The article suggests a few things. Sometimes supervisors in the real world might not fully value or even kind of discourage using certain academic theories.
Right?
Other times the academic knowledge itself just might not be directly applicable or as effective when you're facing the messy reality of clinical work.
Yeah, the real world is messy.
And this, understandably can create big challenges for trainees trying to show they're competent.
Okay, so if these traditional ways can have limitations, where do we look for maybe better strategies? Well, our source highlights that recent research across a whole bunch of fields, medicine, chess, music, even writing, has started offering some really valuable insights.
Interesting.
By studying the kinds of knowledge experts actually use, the stages they go through, and the training methods that seem to work best, we can hopefully find better ways to bridge that theory-practice gap in clinical training.
And what's particularly interesting is that even though these fields seem really different, some basic patterns in how expertise develops are emerging. This research is helping us build a more sort of universal framework for understanding expertise, which we can then tweak and apply to the specific needs of counseling and educational psychology.
Okay, so let's start digging into the different kinds of knowledge experts use. Our source talks about Anderson, a cognitive psychologist, and his distinction between declarative and procedural knowledge. Can you break those down for us?
Sure. Declarative knowledge is basically the knowing that. It's all the facts, concepts, theories, the stuff you usually learn from books or lectures.
Okay.
Procedural knowledge, though, is the knowing how. It's the skills, the cognitive activities, how you actually do tasks.
Yeah.
The key link is that procedural knowledge often develops from declarative knowledge, but through lots of practice.
Right, so it's not enough to just understand, like, a counseling technique intellectually.
Yeah.
You actually have to practice applying it in real situations to build up that practical procedural knowledge. And the more you practice, the more automatic it gets, right?
Exactly. With enough repetition and experience, a task that starts out needing conscious thought, step by step, eventually becomes more automatic, less reliant on conscious control. And the article makes a key point here. Once a skill becomes super proceduralized, experts might even find it hard to consciously explain all the steps. They just do it well. Like, try explaining exactly how you ride a bike. You just do it. Showing someone is way easier than telling them.
That makes a lot of sense. So, what does this mean for experts in counseling and educational psychology?
Well, according to Anderson's framework, experts in any field build up a huge, highly organized amount of this procedural knowledge.
Yeah.
This massive experience lets them rapidly spot patterns in client issues, categorize situations fast, and basically see past the surface details to the underlying dynamics of a problem.
So, it's like they've built this enormous internal library of automatic responses and insights through years of focused practice. Okay. Now, our source also looks into the stages of expertise development. Why is it useful to think about this journey in stages?
Thinking about expertise as moving through stages is valuable because it shows that becoming an expert isn't just a switch you flip, it's a developmental process, right?
Right.
With different phases, each with its own ways of thinking, learning needs, potential roadblocks. By understanding these stages, we can better tailor education and supervision to meet learners where they actually are in their development.
And the article outlines three main general models: Anderson's, Bloom's, and Schumacher and Sherwinski's. Let's start with Anderson's model again.
Okay, so Anderson proposed three key stages. First, the cognitive stage.
Mm-hmm.
This is where novices lean heavily on declarative knowledge and general rules. They're consciously thinking through every step.
Mm-hmm.
Next is the associative stage. Here, they start compiling knowledge, creating and refining specific rules and strategies for doing things. Performance gets smoother.
Okay.
Finally, they reach the autonomous stage. The procedures become highly automatic through tons of practice. This frees them up to execute tasks efficiently and develop more subtle, complex strategies.
Okay, so it's a shift from deliberate, conscious effort to more intuitive, automatic action. How does Bloom's model compare?
Bloom's model gives a slightly different angle, focusing more on the learner's engagement and motivation along the way.
Ah, go.
Stage one is about fun and immediate rewards. Novices often get drawn in by just enjoying the activity and getting positive feedback early on.
Thanks.
Stage two involves a commitment to mastery. Here, learners actively aim for precision, they engage in deliberate practice with focused feedback, and they're really driven by wanting to improve.
Right, the hard work stage.
Yeah. And the final stage is marked by a commitment to personal excellence. The work becomes deeply tied to their identity. It's a form of self-expression almost.
So it's a journey from initial interest and fun to dedicated, purposeful practice, and finally to this deeper level of mastery and personal connection. Interesting. Now, what about Schumacher and Sherwinski's model?
Their model looks at expertise development in terms of how learners understand and use information.
Yeah.
In the pre-theoretic stage, novices tend to focus on surface stuff, and their understanding is mostly based on their own, limited personal experiences.
Okay.
The experiential stage involves recognizing recurring patterns, understanding cause and effect, and developing the ability to think more abstractly about the field. And finally, the expert stage is characterized by the ability to see underlying systemic patterns and to transfer knowledge and insights across situations that might look different on the surface. An expert counselor, for example, might see connections between different clients that a novice would totally miss.
It seems like each model gives a slightly different but complementary view of this whole process. And our source then connects these general models to Schofield and Runestad's stage model, specifically for counselor development. How do those line up?
Yeah, the Schofield and Ronestad model also lays out stages that echo the general models we just talked about. The conventional stage is like the novice phase. Untrained people might approach counseling like being a friend and often feel ineffective.
Right.
The transition to professional stage mirrors those associative or experiential phases. Counselors start imitating experts, actively looking for theory, relying heavily on supervision. They call it conditional autonomy.
Conditional autonomy. Okay.
And the final stages reflect those autonomous or expert levels. Counselors engage in deep self-reflection on their work, consistently integrate theory into practice, and develop their own unique views and authentic style.
It's really interesting seeing these common threads across different ways of looking at it, and specifically in the context of becoming a skilled helper. Now, our source brings up something that sounds a bit counterintuitive. Intermediate learners can sometimes outperform experts on certain recall tasks. Can you shed some light on that?
Yes, this is a fascinating point. The example often used is medical interns might remember a longer list of patient symptoms than experienced doctors.
Huh. Why?
Well, the explanation isn't that the experts have worse memories. It's that their extensive experience lets them engage in really efficient, automatic pattern recognition.
Ah.
They immediately categorize the situation, so they don't need to consciously remember every single detail to understand what's going on or make a good assessment. Novices and intermediates lacking that automaticity, have to rely more on consciously remembering individual bits of info for later analysis.
So it's like the expert sees the whole forest so clearly they don't need to count every tree, whereas the novice is still busy making a list of all the trees.
Exactly. That's a great way to put it.
Okay. And what role does motivation play through all these stages?
Oh, motivation is absolutely crucial, especially for making sustained progress towards expertise.
Right.
The article really emphasizes that moving through these stages, particularly that phase of deliberate practice Bloom talks about, demands a huge and lasting level of motivation.
Hmm.
This drive is what keeps learners going over the long periods, often years needed to achieve mastery. Deliberate practice, while essential for getting better, isn't always fun. You know,
Definitely not.
it takes focused effort, often means facing your mistakes, and needs constant repetition. So both intrinsic motivation, loving the work itself, and extrinsic motivation like goals or recognition are vital for learners to push through the challenges of becoming an expert.
Okay, so we've looked at the kinds of knowledge, the stages of development. Now let's get to the really crucial question for anyone involved in training future counselors. How does knowing all this actually impact how we should approach teaching and training?
Right, this is where the theory hits the road, so to speak. Recognizing these models can really shape how we design training programs to better support students at each step of their development. As the article notes, current approaches often start with basic micro skills and then slowly introduce more complex theories, which does kind of align with the stage-based progression.
But the source also points out that teaching and assessing actual counseling skills during practicum can often be pretty vague, right? Lacking specifics. How can these models help with that?
Precisely. By understanding what characterizes each stage, we can create more explicit and targeted learning goals and ways to assess students at each level. The article really stresses helping students develop the ability to conceptualize clinical problems within a theoretical framework to build a solid problem representation. This lines up with moving from that surface-level understanding in early stages to the more nuanced, systemic thinking of an expert. For instance, practicum students can be specifically taught and assessed on identifying and grouping key client, features a skill that directly helps with the knowledge compilation and pattern recognition that are central to those associative and experiential stages.
So it's about moving beyond just learning isolated techniques to really understanding how those techniques fit into a bigger picture of the client's issues and the theories behind them.
Exactly. And the article describes learning effective counselor behaviors as recursive. Students apply theory with clients, see what happens, reflect on whether it worked, and then adjust their understanding and future actions based on that experience.
Mm-hmm.
It's about actively practicing making those connections between client characteristics, the interventions they choose, and the outcomes.
And it seems like there's a common tendency for new counselors to just focus on trying to solve the immediate problem without really thinking deeply about why a certain approach worked or didn't work.
That's a key challenge, definitely. The article notes that novices might get through a client interaction successfully, but fail to learn much broader lessons from it.
Right.
Becoming a more expert counselor involves building a habit of reflective practice, consciously analyzing their decision-making, and getting a deeper grasp of the complex interaction between the counselor and the client, that whole intersubjective process.
Okay.
It's moving from simple associations to a richer understanding based on inference and context. Intermediate clinicians, for instance, start being able to blend general theoretical knowledge with the specific, subtle details of individual cases.
This is all incredibly helpful. Now, the article gets into some specific knowledge-focused principles and practical teaching strategies to help bridge this gap. Let's walk through those. The first one is about teaching declarative knowledge specifically for handling novel problems. Why is that so important if experts mostly rely on procedural knowledge?
That's a great question. Because while experts use automated procedural knowledge for routine stuff, declarative knowledge is the crucial backup for unfamiliar or really complex challenges.
Ah, okay.
Think back to the driving analogy. Driving a familiar route in good weather is mostly automatic. But if there's a sudden obstacle or terrible weather, you need to consciously pull on your declarative knowledge, driving rules, safety procedures to figure out what to do.
Right.
Similarly, in counseling, when a client presents with something unique or super complex that doesn't fit neat patterns, the counselor's foundational declarative knowledge, their understanding of theories, human behavior, ethics, becomes essential for analyzing the situation and coming up with creative strategies. So, training programs need to identify and effectively teach the core declarative knowledge that helps counselors handle those novel clinical situations.
That makes perfect sense. What's the next key principle?
The second principle is the need to actively teach problem-solving procedures. Since so much of expert performance becomes automatic, programs shouldn't just assume students will naturally pick up essential procedures during internships.
Mm.
Instead, they should systematically break down and explicitly teach routine procedures, like doing an initial assessment, formulating a diagnosis, structuring interventions in their procedural form, as a sequence of goal-directed steps and choices.
Okay.
This explicit teaching makes the path to automation more efficient. Emphasizing reflective practice where students analyze how they use these procedures and providing chances to see experienced instructors model them are also crucial. Novices need both the declarative knowledge behind the procedure and the how, the actual steps and decisions involved.
So it's not enough for students just to learn about different diagnoses. They need to be explicitly taught how to conduct a thorough assessment, the specific steps to gather info, and how to use it to arrive at a differential diagnosis.
Precisely.
Mm.
And the article even mentions cognitive task analysis as a good tool for unpacking the often unconscious procedural knowledge of experts, making it possible to identify and teach those crucial steps to novices.
Okay. The third principle focuses on the vital link between supporting knowledge acquisition and the student's motivation to practice. Tell us more about that.
This principle highlights that training programs need to give equal weight to teaching theory and to fostering students' motivation, both intrinsic and extrinsic, to practice consistently during training and throughout their careers.
Mhm.
This ties into motivated, deliberate practice, as Erickson described it. Deliberate practice isn't just any practice. It involves clear tasks, challenges that stretch the learner, good feedback, and chances for repetition and fixing errors.
Right.
It's often not inherently fun, but it's absolutely essential for reaching higher expertise levels. So programs need to actively cultivate this motivation for continuous improvement. And the article even suggests maybe considering motivation when admitting students to grad programs.
That's a really strong point, that the drive to do that tough, deliberate practice is just as vital as raw ability. Okay, what's the fourth principle the source highlights?
The fourth principle emphasizes strategically setting up internship experiences to help students systematically practice the procedures they've learned.
Okay.
Recognizing that what you need from practice changes at different stages of expertise, programs should carefully tailor the practice requirements. Once students have a basic grasp of effective procedures, their internships should provide structured chances to apply these skills systematically with a variety of clients and issues.
So it's about going beyond just logging internship hours to making sure those hours involve targeted practice of specific skills with good supervision.
Exactly. And the fifth principle builds right on this, focusing on defining specific instructional activities meant to foster advanced expertise. Teaching assignments should match students' current educational and developmental needs, with clear learning goals that motivate that deliberate practice. The article outlines general training steps: providing information, getting students actively involved, offering chances to refine skills with feedback, and ensuring students are fully focused during practice. A key part here is that students should practice applying solution steps across different kinds of problems and develop good strategies for organizing their approach.
It sounds like a very intentional, scaffolded way to build skills. What about the broader context where learning happens?
That's covered in the sixth principle, which stresses picking an adequate context for training. Expertise doesn't grow in a vacuum. The social environment around it matters a lot.
Right.
The right scope of practice for novice counselors should be carefully defined based on how complex the problems are that they're expected to handle. And there should be a shared responsibility among educators, supervisors, and the students themselves for the novice's development and performance.
Okay. And the final principle our source discusses concerns the sequencing of training. Tell us about that.
The seventh principle pushes for logically sequencing training to mirror how the knowledge and skills will actually be used in practice using that scaffolded approach.
Right.
This means organizing the curriculum so foundational concepts and simpler skills come before more complex, nuanced stuff. If there isn't a strict necessary order, then generally easier concepts should come before harder ones. This helps students build a solid base and see how what they're learning connects to their future clinical work.
These are all incredibly valuable, really practical insights for improving clinical training. It really drives home the critical role of intentionally bridging that gap we always hear about between theory and practice.
Absolutely. The main message here is that developing expert clinicians needs a deliberate, integrated, and stage-aware approach. It needs to value both the essential theories of the profession and the systematic development of practical skills through focused, supervised, and reflective practice.
So, just to quickly recap some key takeaways for everyone listening, we've looked at the crucial difference between declarative, knowing that, and procedural, knowing how, knowledge, why it's important to see expertise as unfolding through distinct stages, and the need for specific teaching strategies that stress deliberate practice, systematically applying learned procedures in real clinical settings, and keeping a strong focus on both knowledge and the learner's motivation to do the hard work of skill building.
That's an excellent summary, and it really underlines that becoming an expert in any field, but maybe especially in the helping professions, isn't just about passively soaking up information. It's about actively turning that knowledge into effective, ethical action through consistent effort, focused reflection, and a deep commitment to keep learning.
This has been a really enlightening deep dive into developing expertise in clinical training. It definitely makes you think about how these ideas could apply in so many other fields, too. Considering these insights, what other areas of professional training or skill development do you think could really benefit from a more integrated approach? One that explicitly links theory with practice and focuses hard on the how of becoming an expert. It's certainly something for all of us to chew on in our own quests for mastery.
Indeed, it really poses a fundamental question for anyone involved in education, mentoring, or even just their own personal growth. How can we move beyond just passing on information and instead actively cultivate real expertise in ourselves and in others?